With the creation of the National Mental Health Act of 1946, the National Institute of Mental Health was founded. The institute revolutionized mental health treatment in America. For the first time ever, the issue of mental illness was put into the national spotlight, increasing access and awareness regarding mental health. Because the National Mental Health Act was the first of its kind, it paved the way for the passage of future mental health legislation. With the Second World War drawing to an end, most Americans were celebrating back at home. However, few had any idea of the psychological traumas that these battle-weary soldiers were burdened by. Sadly, many veterans experienced symptoms of post-traumatic stress disorder, PTSD, depression, anxiety, and other similar disorders. These veterans were put on the back burner because treatment around this time solely focused on the most severe or chronic mental health issues. There seemed to be no help in sight for those suffering from depression, anxiety, and related illnesses. In addition, there was also a profound deficit in professionals in the field of mental health. This unfortunately means that many veterans received inadequate amounts of care. To add to that, mental health was extremely stigmatized. After years of neglect, the veterans were fed up. They decided something needed to be done about the problem. As a result, thousands of veterans and their families all across the country organized protests aimed to pressure legislators to change America's mental health policy. Over time, these protests started to gain momentum. More and more people started to join the movement to support these veterans. Soon, the protests were heard all throughout the nation. The American people demanded mental health reform. Finally, legislators succumbed to the pressure of the people. On July 3, 1946, President Truman officially signed the National Mental Health Act into law. Through the act, the National Institute of Mental Health, or the NIMH, was born. The institute focused on tackling the issue of mental health on three main fronts: prevention, recovery, and cure. Soon, the NIMH became the forefront of mental health treatment in America. The institute established thousands of mental health clinics, funded research centers all across America, and led to a huge shift in mental health treatment. Fortunately, the NIMH broke barriers in three distinct ways: medical treatment, legislation, and awareness. First is medical treatment. Prior to the passing of the act, the mentally ill were treated in insane asylums, which were largely ineffective. They were treated inhumanely as they were isolated away from society and neglected by people. Consequently, the asylums did little to nothing to treat them, and often they ended up in a comparatively worse condition than before. Even worse, they were misdiagnosed often, leading people with mild mental illnesses to be treated the same as those with severe mental illnesses. As such, the mentally ill spent a vast majority of their lives suffering in the cruel conditions of the insane asylums. Thankfully, the NIMH strove to reform the way the mentally ill were treated and help those that were once neglected. Through extensive research conducted by the NIMH, psychologists began to realize that patients would benefit more from treatment and evaluation rather than institutionalization. Thus, a paradigm shift in mental health policy occurred, known as deinstitutionalization. Throughout America, there was a huge movement to build community psychiatric clinics to treat those with mental illness. Shortly after the act was passed, thousands of clinics were built. These clinics proved effective in providing treatment with individual care and medical treatment to help people recover. Moreover, they provided the community with preventative treatment through the development of community programs that decreased the number of unnecessary hospitalizations and long-term institutionalizations. These clinics provided much better therapeutic treatment, making it an ideal place for patients to stay rather than asylum-based hospitals. In addition to being a better environment, these clinics played a key role in distributing drugs that revolutionized mental health treatment. The NIMH began treating patients with new types of medications.
But by the early 1970s, that's changing. So it's an NIMH researcher, I think it's Julius Axelrod, who ends up discovering the mechanisms by which antidepressants work. He figures out how reuptake of serotonin works in the brain, and once you can alter that via a drug, you get antidepressants. So that's where Prozac comes from. And Axelrod is sort of working under the NIMH when it comes up with this. Or they also champion, I think again in 1970, lithium as a treatment for bipolar disorder, and that's its own complicated history. Lithium is actually kind of an old drug, but it gets banned in the United States when a bunch of people are sickened or killed in treatments totally unrelated to mental illness, actually. And then the NIH comes back to it and sort of works to discover that actually this can be effective at treating bipolar disorder.
Although the NIMH distributed many drugs, such as insulin shocks, one drug stood out: Thorazine. Thorazine is a drug used to treat psychotic disorders such as schizophrenia, manic depression, and severe behavioral problems, and became the main drug used to treat mental illness. Thorazine proved to be extremely effective in reducing the effects of mental illnesses and put millions of Americans on the pathway to recovery. All across the board, mental health treatment in America drastically improved. For the first time ever, the mentally ill broke barriers by gaining the ability to reintegrate themselves back into society. Another major impact of the Mental Health Act was that it led to the destigmatization of mental illnesses and increased awareness about the mentally ill. It highlighted their need for assistance and professional help. Prior to the act, most Americans had a stigma against those with mental disorders. They were viewed as outcasts of society. Nobody seemed to be willing to help aid the mentally ill navigate their way through treatment, and there was a lack of professionals in general to assist them. However, with the passing of the National Health Act, more citizens became aware of the effects and causes for mental health. They became more educated about how mental health does not mean the end of the road for the mentally ill, and how these individuals require help in order to get better. More citizens became aware that it was completely normal to have a mental illness. The Mental Health Act destigmatized the negativity surrounding the mentally ill, allowing the people to see them as ordinary humans. Put simply, the act broke barriers in the way people viewed mental illness in America. As a result, people with mental illnesses across America were not defined for their mental illness, rather their overall character. The newfound understanding for people with mental illnesses created new opportunities for those with mental illnesses in America to move up in society. For example, while most employers would have rejected workers for having a mental illness before the act, after the act, many employers hired those with mental illnesses. As a result, the quality of life for those with mental illnesses drastically improved. The National Mental Health Act of 1946 paved the way for future legislation that aimed to improve the treatment of those suffering from mental health. The NIMH was influential in shaping mental health policy, research, and public outreach. Due to its success in treating the mentally ill, the act set a precedent for future mental health legislation. Soon after the act, many other acts were passed addressing the issue of mental health. For example, in 1955, the Mental Health Study Act was passed, resulting in the influential report Action for Mental Health. This report created a cabinet-level committee to oversee mental health policy on a national level. For the first time ever, America was able to truly evaluate the condition of mental health in America. This allowed the NIMH to address the real needs of the people. Additionally, in 1963, President Kennedy signed the Community Mental Health Act of 1963, which gave $150 million to build mental health centers rather than hospitals. In doing so, it set a precedent for other presidents to follow. As a result, the act helped carry out the agenda of the NIMH and significantly improved the quality of treatment for people all across the country. Ultimately, the National Mental Health Act of 1946 inspired future legislation that set America on a pathway to improve access to quality mental health treatment. The legacy of the act is still seen today. Now, more than ever, mental health has become an increasingly important issue for Americans. Treatment for mental health is dramatically improving, new drugs are constantly being developed, awareness for mental health is at an all-time high, and more reforms to mental health policy are being made. The National Mental Health Act of 1946 was a major stepping stone that constituted the insurgence of mental health awareness and treatment. The act broke legislative and stigmatizing barriers by opening the floodgates to the creation of many mental health facilities and mental health treatments. The Mental Health Act prompted a significant ideological shift in Americans. Society began to accept people with mental illnesses. For millions of Americans with mental illnesses, the National Mental Health Act of 1946 sparked change for the better.